X-ray contrast refers to substances that are used to enhance the visibility of internal structures during medical imaging procedures such as X-rays, computed tomography, CT scans, and angiography. These substances work by absorbing X-rays differently than the surrounding tissue, making the structures they are injected into or ingested with appear more clearly on the resulting image. History. The use of contrast agents in medical imaging dates back to the early 1900s, when barium sulphate was first used as a contrast agent in X-ray imaging of the gastrointestinal tract. This led to the development of other types of contrast agents, including iodine-based contrast agents, which became widely used for a range of imaging procedures. In the early days, these contrast agents were relatively crude, and the side effects were significant, but as technology advanced, so did the development of contrast agents. Today, there are many different types of contrast agents available for use in medical imaging, each designed for specific purposes and with different properties. Types of contrast agents. There are two main categories of contrast agents, positive and negative. Positive contrast agents contain high atomic number elements, such as iodine or barium, which appear bright on X-rays and CT scans. Negative contrast agents contain low atomic number elements, such as air or carbon dioxide, which appear dark on X-rays and CT scans. Positive contrast agents. Iodine-based contrast agents are the most commonly used positive contrast agents in medical imaging. They are used for a wide range of procedures, including CT scans, angiography, and intravenous urography. Iodine-based contrast agents are typically administered intravenously, although they can also be ingested orally or rectally. They are generally safe, although there is a risk of allergic reactions, particularly in patients with a history of iodine sensitivity. Barium sulphate is another commonly used positive contrast agent, particularly for imaging the gastrointestinal tract. It is ingested orally as a suspension and provides a high degree of contrast between the digestive tract and surrounding tissues. Gadolinium-based contrast agents are used for magnetic resonance imaging, MRI. They are typically administered intravenously and are particularly useful for imaging soft tissues, such as the brain and spinal cord. Negative contrast agents. Air or carbon dioxide can be used as negative contrast agents to create contrast between air-filled structures, such as the lungs or intestines, and surrounding tissues. These agents are generally safe, although there is a risk of pneumothorax, collapsed lung, or perforation of the gastrointestinal tract if they are not administered correctly. Uses of contrast agents. Contrast agents are used to enhance the visibility of internal structures during medical imaging procedures. They are used to identify and diagnose a wide range of conditions, including abnormalities in the digestive tract, such as ulcers, tumors, and obstructions. Blockages in blood vessels, such as aneurysms, stenosis, and thrombosis. Cancerous tumors and other abnormalities in the liver, kidney, and other organs. Inflammation and infection in the lungs, sinuses, and other areas. Nerve and spinal cord abnormalities.